November is Diabetes Awareness Month. The condition affects more than 37 million Americans. Nurse practitioner and owner of the Diabetes Center in Ocean Springs, Arnold, joins us now with a closer look at how to prevent diabetes and the warning signs to look out for. Thank you for joining us. It is Diabetes Awareness Month. In fact, Governor Tate Reeves made a declaration surrounding that.
Proclamation for awareness for type 1 diabetes, actually very exciting. That's the first time we've had that from the governor. And Mississippi, you mentioned the national numbers. Mississippi, it's 333,000 people in the state of Mississippi have type 1 or type 2 diabetes, and 75,000 people don't know they have it. So that's why November is the month to get the word out and to get screened. And type 1 is where the pancreas doesn't function and people are treated with insulin. It can happen as a child all the way up to elderly population. Type 2 is where the pancreas slows down. It's a much more genetic connection, and people need exercise, eating better, medications, and sometimes even need insulin for type 2 diabetes. So that's how, that's the difference between the two diagnoses. For screening, for type 2 and for type 1, we can test for the blood sugar to see if it's elevated. There's two tests we typically do, a glucose test and a hemoglobin A1C. And that tells you if you have the diagnosis of diabetes. But we can also screen preventative now for type 1. So there is antibodies we can test for, and there's 5 of them. And you can get tested at, there's a website called askhealth.org, ASKHEALTH.org. And you could be tested through a research trial through the Barbara Davis Center if you have family members with type 1. If you get screened for type 1, then there is now a medication that can delay the onset for type 1 diabetes. And so we're offering that here in this community. That medication is called Tzield. And never in my 20 years of owning the Diabetes Center, but I think that we would get to the point that we could delay the onset for type 1. So lots of hope and lots of great options. And if someone does have the diagnosis of type 2 or type 1 diabetes, there's great treatment options that we have. And so much of what we're doing now is with technology, with continuous glucose monitoring systems, also called CGMs. These are little devices that you wear on your arm or your skin, and it tells you what your blood sugar is automatically to a phone or to a reader, which is great for people who have high or low blood sugars. We also have insulin pumps if you're type 1, and it can be used also for type 2s. And these are devices that give insulin, will connect to that CGM, and raise and lower the insulin dosages to help people with diabetes.
So much progress being made there, and you mentioned a big number with people who might have diabetes that don't even realize it. So what are the top warning signs to look out for?
So great question, Hugh. Peeing for no reason, like lots of excessive urination, hungry all the time, and the one that really makes the back of my hair neck go up is when people are losing weight for no reason. So that can mean that your body is not functioning well. So those are the key symptoms to watch for.
Okay, and if people are interested or they want more information, how can they reach out to you directly?
We have a website, kcdiabetes.com, and then also the American Diabetes Association, diabetes.org, has a treasure trove of information about diabetes.
Yeah, and you mentioned how widespread it is with people dealing with this condition. It's good to bring awareness to it. Thank you so much for joining us.
Thank you so much for